We're going to see a lot of our ambulance compliance officer today. So Nelson Castee from Emergency Management, would you lead us in the Pledge of Allegiance, please?
Yes, sir.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome to the August 26, 2019 meeting of the Shawnee County Board of Commissioners. My name is Bob Archer. I currently serve as chair of the commission and represent District 3 alongside Commissioner Bill Rippon, who represents District 1, and Commissioner Kevin Cook, who represents District 2. Good morning, everyone.
Morning.
Morning.
First item of business, please.
Consent agenda?
There were 8 items on the consent agenda, a lot dealing with the Apple Festival. Are there any questions or comments?
I'll move for approval as presented.
Second.
Motion made to approve the consent agenda by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
New business, A, County Clerk, number 1, consider all voucher payments.
Under Bridge Project, Finney and Turnip Seed, $60,000 is for construction inspection phase for Southeast 29th Street Bridge over Deer Creek. Under Infrastructure, Bettis Asphalt and Construction, Inc., $610,773.91 is for Southeast Gary Ormsby Drive, U.S. Highway, northbound on ramp to Innovation Parkway. Under Special Public Works, Kevlar Construction Company, $133,408.41 is for final payment for Northwest Bailey Road over Snake Creek. As of August 23rd, 2019, total vouchers, $1,946,379.37. And I move that we approve the vouchers.
Second.
Motion made to approve the vouchers by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Number 2, consider correction orders.
I'll move to approve.
Second.
Motion made to approve the correction orders by Commissioner Archer, seconded by Commissioner Rippon. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Number 3, consider approval of resolution number 2019-61, authorizing a temporary 2019 cereal malt beverage license to Shriners International, DBA Arab Shriners, to sell beer at the Shawnee North Community Center, 300 Northeast 43rd Street, Topeka, Kansas, on August 30th and 31st, 2019, for a special event.
Questions about the resolution? I'll move to adopt the resolution.
Second.
Motion made to adopt the resolution by Commissioner Archer, seconded by Commissioner Rippon. All in favor say aye, opposed no. Motion carries 3-0. Next item, please.
Item B, corrections. Number 1, consider authorization and execution of Contract C-314-2019, Memorandum of Understanding with Boys and Girls Clubs of Topeka for the Comprehensive Youth Development Program managed by BGCT during state fiscal year 2020 with no cost to Shawnee County.
Good morning, Commissioners. Trenton James, Shawnee County Community Corrections. I'm here in the absence of Director Cole and as well Timothy Phelps. You guys have the memorandum before you for the program. I believe currently there are 15 Boys and Girls Club organizations throughout the community. The biggest part is that this grant is going to help them focus on career development, tutoring, mentorships, and various things that would assist these youth in becoming pro-social individuals in the community.
For the public, is this a new program or extension of an existing program, and has it been successful?
It's an existing program. I believe last year they serviced over 2,100 kids in the community, which is a magnificent feat considering most of these kids are not actively engaged in the system. Currently, these are kids we're attempting to push away from the criminal justice system. Success-wise, I believe it's done really well.
2,100.
Yes, sir.
Excellent. Questions or comments?
Move for approval.
Second.
Motion made to approve the contract by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Opposed, no. Motion carries 3-0. Thank you so
Have a
much.
great day.
Next item, please.
Item C, Parks and Recreation. Number 1, consider approval of request to solicit bids for concrete services for repairs and for new, smaller-scale projects with funding from a variety of sources.
Good morning, Commissioners. Tim Laurent, Shawnee County Parks and Recreation. It seems like every time I come up here now, I'm talking about concrete, but I promise we do more than concrete. This is essentially, we want to solicit bids for our trade service provider for concrete. So this is separate from what we were up here for last week. This would be smaller projects as we move forward. It'd have to be under $10,000, and it could be anywhere in the system wherever we needed it. With that, I'd be happy to answer any questions that you might have.
Questions for Tim?
Move that we approve.
Second.
Motion made to approve by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Opposed, no. Motion carries 3-0.
Thank you.
Thank you, Tim. Next item, please.
D, Public Works. Number 1, consider approval of change order number 1 reflecting final as-bid versus as-constructed quantities resulting in a decrease of $325.54 for the Southwest Gary Ormsby Drive, U.S. Highway 75 to Southwest Innovation Parkway Reconstruction Project.
Good morning, Commissioners. Kurt Neas, Director of Public Works. Gary Ormsby project finished here during the week of August 9th, and now it's time to kind of final out that project. And so we have his final change order, which really reconciles the difference between as-bid quantities and final construction quantities. As read out, there was a slight decrease of approximately $325. Now, also, this project was going to be split 50-50 between Shawnee County and the city of Topeka. The total project cost was $685,654. Divide that by 2, you get $342,829. Shawnee County has so far paid the contractor $600 and the contractor and some contingency, the public notice, which amounted to $610,839. You take the difference, and that is what we have billed the city of Topeka for. So with that, I'll take your questions.
Questions for Kurt?
Timeline for being paid by the city?
Pardon me?
Is there a timeline?
I asked this morning if we'd receive payment, and we have not yet, but I don't expect any serious delay. It should be here any time. Maybe I'm being optimistic, but that's how I feel at this point.
I'm sure there will be no problems. Other questions?
Move for approval of the change order.
Second.
Motion made to approve the change order by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Opposed, say no. Motion carries 3-0. Thank you. I'm
you.
glad this project's done.
Yes, very much so.
It's needed to be done for a long time. Thank you, Kurt.
Yeah.
Next item, please.
Item E, Emergency Management. Number 1, consider authorization and execution of Contract C-315, 2019, an amendment to Contract C-207, 2016, with American Medical Response for the enactment of the B+A 2019 trial program.
Morning, Commissioners. Nelson Castiel, Ambulance Compliance Officer. Have a presentation here to kind of help us out. This is a very short contract, but there are a lot of parts to it and what we hope to gain from this waiver. And so I'm going to briefly go through just a little bit of history, where we have been, where we are, and where we're going. In March of 2015, you folks asked the Ambulance Advisory Board and the RFP Committee to come up with an RFP. We had had the same contract with AMR at that point from 2006 to 2016. It was going to expire. Previous to that, there was another contract that had less benefits in it for Shawnee County. So as we've gone forward, we've added benefits to our first responders, to our citizens, to everybody out there that uses this service. The intent of the RFP and the resulting contract, which is C 2007-2016, which this contract here will amend for the waiver. We left room for expansion. We left room for innovations. We wanted to see if there were new trends, new best practices, any lessons learned, and that's kind of where we are, is on all three of those right now. We have reaped a lot of benefits out of the contract, which I outlined in the final report I gave in June for 2018. Looking at 24 months of compliance, and I'll show you the graphs here shortly, and as was delivered in the annual report, we noticed some increasing trends and a large increase in call volumes. And we need to address those increases in call volumes. It's apparent that the current resources that we have are taxed on not only a daily note on a daily time frame, but also sometimes on an hourly time frame, where you have not had in the past, during my time as a compliance officer, hours where you had between 13 and 16 calls per hour, and a large number of them being transports. And that not only taxes the AMR part of the system, it taxes the first responder side of the system. Just briefly, AMR has to meet 80% every month, spread over these zones, for being on time. Everything is aggregated. The Turnpike does not have any penalties involved for fines, because it's a special 4-zone area due to how you can and cannot get access. AMR then, for all these zones, it doesn't matter if it's an emergency call or a non-emergency call, if they are over the times listed up there in the zones, they pay $10 per minute. And that's where our fines and penalties come from. This waiver is about stopping the clock and getting the right resource to the right location at the right time. And what I talk about with stopping the clock is, since the 1991 contract, I believe, and I have not been able to find the verbiage previously, AMR and their predecessors were required to be on scene with a paramedic to stop the clock. Did not mean that they had to have a transportable paramedic, meaning didn't have to be an ambulance, it could be a fly car or anything else like that. They just had to provide a paramedic, which we call advanced life support. That becomes a little troublesome because, as I'm going to show you here in a second, we have a lot of calls out there that don't need a paramedic. Probably 84% of the calls, just crunching some numbers for the last 2 years, do not need a paramedic on scene. The other 16% they do. And what this waiver will let us do is to implement a program here where we can stop the clock on certain types of calls, certain triaged calls, certain priority calls, that allows the clock to stop if there is not a paramedic on scene, but there is an emergency medical technician on scene, which is a lower level of care called basic life support. So before you, and I'm not going to read this, but this is directly from the memo, Section 2.2, as it's indicated here on the amendment for the waiver, this would allow my office for certain alpha and omega level calls, and I'll define those here for you in just a second, can be handled by basic life support units only. And what that entails is when calls come in, they are triaged by the emergency medical dispatch system. They have, and I'm going to show you a book here. Since we're in the times of computers, let me get back to the microphone here. Since we're in the times of computers, this is computerized, it's up on their screen. But this is what I use because I don't need that on my screen. This is how a call comes in, and from start to finish, they go through and ask various questions. They're all in there. They do not deviate from that, which is the brilliant part of this program, and they decide where does that call fall priority-wise if we're handling other calls. Now, if it's the only call, that makes it pretty easy, but they're going to dispatch the call. But if there are calls holding, if they have people waiting, it's a busy day, and those calls holding happen for any numerous reasons out there. They're stuck at a hospital. We have a bad day where a lot of calls are taking place. Flu season is going to be long again. So when you ended up with flu in April and May, that could be a reason that there's a lot of calls out there. This tells the dispatchers how to dispatch out there. So this is the increase we've seen in calls. I kind of expressed this in the annual report. For the year 2018 that we just completed, AMR basically in 12 months ran the equivalent of 13 months worth of calls. And that's where you see the increase there. A lot of these calls were non-medical in nature, such as I've fallen and I can't get up, or my toe hurts, or I need a ride to the hospital. AMR does not have the privilege, and they're not allowed, based on a customer's manner of payment, meaning just because the person can't afford to pay them, they cannot deny service. And so they end up taking a lot of transports to the hospital based on that fact that if the person wants to go, they pretty much have to transport them, and I'll let John hit on that just a little bit here because they have certain policies and procedures in place. We have a lot of low acuity calls. I believe Commissioner Archer was out on a ride-along a while back where he got to witness quite a few low acuity calls. We've seen during the seasonal illnesses where we have flu and other things where these people may need to go to the hospital. They don't need to go right now, but we have to get a paramedic there to them, so they're going to end up waiting. Some of these types of calls are calls that basic life support can go out there and take care of because they don't need a paramedic. Not every call needs a paramedic. It's nice to have them, especially when those calls are going bad, but we need to be able to structure and have a tiered response here. I talked about the book there, the Alpha and the Omega. The Omega is the blue thing up there in the corner. And all the calls that come in, and we'll just start with number 17 because that seems to be the favorite right now. When 17 comes in, they say they've fallen. They go to the pages in there or on their computer to the fallen information. They ask the questions, and then they decide, does that fall go for A, B, C, or D, or Omega? Could go for E, which is mostly your code blues and the really, really bad, serious things out there. And as you can see, an Alpha call, it's a BLS capability. You don't have to rush to get there. A Bravo call, which this program will not be a part of, to have ALS on the scene. And each of those cards, as they come out, this is what goes in the computer. The dispatcher dispatches and looks at it and says, okay, this unit goes. Or we need to wait because I have this unit, and that's how they prioritize. The biggest thing that we're seeing, and I mentioned our first responders, and they do a great job in this county, and there's been a lot of collaboration and communication in recent months. If we have first responders on scene, meaning a fire department, they have to wait because when they get there, their call is a low triage. They can't leave that patient. They have to wait for an ambulance. If there are no ambulances available, meaning waiting for the ALS to get there to stop the clock, that's problematic. Yes, the ambulance company does pay penalties and fines of $10 a minute, and we have seen fines of upwards of $800 for one call that turned out being low priority. The reason the low priority calls get the most fines is it does not matter what time that call came in. If there's something higher level, that call gets shifted to the bottom because we want them taking care of that higher level call. And that's the purpose of the EMD and why I showed you that book. This is just a brief chart here. I don't want to say that the sky is falling. It's not. In 2018, and I'll stress this for our media folks, in 2018, out of all of the calls that they ran, they were only fined for 3.5% of the total calls they ran for 2018. For 2017, they were only fined for 2.7% of the total calls that they arrived on. Out of 22,000 and some calls, 819 is not a concerning number. If it was to get to 10%, we might start worrying just a little bit. So I'm going to conclude mine. and this, Tim can have this one or I'll send it to him. This is not a way for AMR to beat the clock. That is not the purpose of this, and hopefully the document explains it. This is not a way for AMR to reduce units on the street, which seems to be the most popular complaint I get on a daily basis. This will actually add units. The basic life support units, they will augment in with the advanced. This is not a way to make the contract easier to meet. No, this is going to be entertaining, to say the least. And the last part is, this is not a way, and this is my second largest number of complaints, for AMR to make more money and profit. This has been run through the Ambulance Advisory Board. It's been run through the fire department chiefs. It's been run through the protocol working group as well. We have a timeline set up that is in your document there, and we will be having significant oversight to make sure, meeting on almost a 3-week basis, and we will be providing reports to make sure that if there are issues in this trial program, that we are catching them. Do you have any? I'll stand for any questions, or I'll let John come up. And
Are there questions for Nelson? Yes, Commissioner Cook?
Nelson, or maybe John, as the city of Topeka shifts from a basic life support to advanced life support, adding paramedicine to their trucks, how will this coordinator, thoughts, responses to how the two will interact?
I mean, we have a great working relationship. I mean, they were part of this conversation and putting these trucks into place. Really, the only time it becomes a problem is the EMD process can miss occasionally. We've went back and looked at the numbers. It's very slim when we actually miss those numbers or the actual triage. In the event that we send a BLS unit, we're going to rely very heavily on our first responders to immediately notify us, make appropriate triage, and get an ALS unit en route. There's also some talk that's occurring between the fire departments that have ALS providers of, in the event that this is a time-critical patient, with working with the hospitals as well as the medical directors, their preference is that we just get that patient to the hospital as soon as possible to higher level in care rather than waiting for a paramedic to arrive.
So the change in the contract is more just to respond with making sure you're sending the appropriate level of care for each call?
Yeah, exactly. I mean, it is a daily basis that we are running the stub toes, the falls without injuries, and it literally takes an ALS unit that could be responding to a heart attack or ties up that unit while they're on scene. And this will just allow us the ability to supplement our system. This is not a way to beat the clock. It's not a way, and in fact, in the event that we do transport BLS, we're reimbursed less money. So some of the questions of we're going to make more money off of this is not actually true. With Medicare and Medicaid, we'll be actually reimbursed less money. So it's going to have negative consequences on us, but that's not the focus. Our focus is getting the right resource to the right patient.
So if I understand correctly, the service that AMR provides will not change, but life-threatening situations may be better prioritized than they are now.
Right. They already are prioritized, and when you go back and you look at those fines, if you pull the run numbers, what those are those low acuity calls. The patient has fallen, maybe they have leg pain.
Right.
We're the only way they can get to the hospital, but the chest pains and the strokes and the diabetic emergencies and the seizures are all coming in. So our first responders are stuck waiting until we can clear an ALS unit that's not on a high priority call to come and get them. This will allow us that opportunity to dispatch a BLS unit to that scene, transport that patient, hopefully get our first responders back to their stations quicker as well.
Okay, I think the public wants to know that the service is still going to be provided in
Oh, for
an
sure, for
excellent
sure. We're not
fashion.
reducing the number of ALS units
Okay.
that's going to be on the roads. This is simply supplement and to allow us to provide a better service.
Okay. Commissioner Rippon?
No questions.
I'll move to approve the contract and thank you for the service. And Nelson, thank you. Your service is appreciated, certainly. So I'll move to approve the contract.
Second.
Motion made to approve by Commissioner Archer, seconded by Commissioner Rippon. All in favor say aye, opposed no. Motion carries 3-0.
Thank you.
Thank you. Keep up the good work. Next item, please.
Administrative communications.
This is an opportunity for department heads or any member of the public to address the commission.
Good morning. Nate Greer, Shawnee County Parks and Recreation. I just want to make an announcement that we are hosting the USA Softball Men's Class E National Tournament this upcoming weekend. The primary location is at Rieger Softball Complex. Secondary location is up at Shawnee North. We're really excited. We have 25 teams registered so far, and we're really excited to bring adult softball tournaments back to Topeka. Next year, we're going to host the Class D and hopefully a few more.
Thank you. Hope we have good weather.
Oh,
Good morning, Commissioners. Linda Oakes from the Health Department. This week, the Health Department is hosting the public meeting for the update of the Bikeways Master Plan. So that meeting will be Thursday from 4:30 to 6:30 at the Health Department, 2600 Southwest East Circle Drive. There's also a survey out right now. So the Metropolitan Topeka Planning Organization, which Shawnee County does participate with, is working on updating the Bikeways Master Plan right now. So there's a survey. You can come to the public meeting. So I hope everyone will participate in some way, whether you ride or not, because I can tell you that if you like to walk, a lot of these plans do impact people who like to walk also and run. So we've already had a lot of things done in the city of Topeka as far as sharrows and a few bike lanes, and so we're looking at the next step. And then the Shawnee County and the townships manage the off-street recreational trails and on-street bicycle facilities beyond the city limits. So more ways to bike and walk and run, so we hope folks will come out. Thank you.
Very good. Thank you, Linda.
Good morning,
Good morning.
Commissioners. Lynn Lee from the Shawnee County Health Department, epidemiologist. August is National Immunization Month, and so I wanted to share my epi-surveillance. Vaccines, get your vaccines. As you may know, Kansas added 2 more vaccinations for all students that are attending school this year. So we added hepatitis A, and we also added meningococcal. And earlier this summer, the Kansas Department of Health and Environment also completed a study looking at kindergarten vaccination coverages in all of Kansas. And so I just wanted to look at how well we're doing compared to the state and the Healthy People 2020's goal. And so here, for Shawnee County, for the children entering kindergarten of last year, 81% were up to date on their vaccines, compared to the state at 84%. And so really we want all of our kids to be hitting the goal of Healthy People 2020's goal of 95%. And so the graphs that I show here, Shawnee County is the orange line. Kansas is the yellow line, and the Healthy People 2020 goal of 95% is the green dots. And so as you can see, we're pretty consistent through the last 10 years or so, but we never hit the Healthy People 2020 goal. And the issue with not hitting the 2020 goal of 95% is that vaccine preventable diseases such as measles, mumps, and rubella, and varicella, so chickenpox, have a high infectivity rate. And so we really need it to be at 95% to protect the children that can't be vaccinated, so the herd immunity. So I go on to, here are 2 other graphs, so the MMR, so the measles, mumps, and rubella, and also the chickenpox. Still, again, we haven't hit the 2020, Healthy People 2020 goal of 95%. So I wanted to see if, if we haven't hit it, do we have outbreaks here in Kansas? And so from what I could find, we've had at least 24 vaccine-preventable disease outbreaks in Kansas. As you may know, last year we had a measles outbreak in Johnson County. And currently in the United States, we have the worst measles outbreak since 1992. And we have currently, as of last week, it was 1,200 confirmed cases in 30 states. Every week I go into case conference and we talk about the cases, we talk about the number of cases from the previous week, and thankfully we have not had any cases in Kansas. I will say we knock on wood, we knock on fake wood, we knock on made up wood. We really don't want any cases of measles here in Kansas, and none in Shawnee County. So I end with looking at the history of the anti-vax movement. If you're interested, you are welcome to read it. But basically, from the Kansas Department of Health vaccine study, there have been increases of non-medical vaccine exemption rates. And so when we have increasing numbers of non-medical vaccination exemption, it really does increase the risk of cases and outbreaks here in Kansas and in Shawnee County. And that's all for my paper. Do you have any questions for me?
Obviously, there's a problem. And usually when there's a problem like this, there's an action plan to address that problem. What proactive steps is the health department taking to get to 95%?
Linda's coming. My backup's coming. We, at least for this month and probably for next month, we've increases the hours for our immunization clinic. We make ourselves very accessible and available. We are on social media encouraging people. This paper is out to over 900 providers in the community, and so they are very much so aware of our rates and our current situation. And, you know, on every single paper of mine, I always have a what providers can do. And so research over and over again consistently show that providers and their strong recommendation is really one of the key to tipping a family that may be hesitant to vaccines to get vaccinated.
Lynn Dukes from the Health Department. Yeah, Lynn summed it up very well. That strong recommendation we know is the best way to get folks who are vaccine hesitant to take vaccines. We also communicate a lot with the schools. It's up to the schools to enforce the regulations. And so we work with them quite a bit to help them any way we can. When we have cases of chickenpox, which we have had in our schools, we work very hard on identifying children who need to be vaccinated. We get them in. We'll stay late. So we try to go the extra mile when we see this. There's always going to be a few people who refuse to vaccinate. Right. And so we just have to keep working and educating folks on how important it is. But we would really like to see that rate get up to 95%, especially for measles, because boy, it's just not high enough right now. So those are the things we're doing.
Good. I hope our media people here will highlight this. This is, it confounds me that people do not get their kids vaccinated. I don't understand it. So thank you very much.
Thank you.
Anyone else for administrative communications? Commissioner Cook?
I don't have anything today.
Commissioner Rippon?
Nothing.
Me either. Next item, please.
Executive session?
There's not a need, so we're officially adjourned. Thank you for attending today.
Nelson probably needs his book back.
That's complicated, isn't it?
I don't think so.